Good afternoon, everyone, and thank you for joining us for today's webinar, Speaking the C-Suite's Language Data Executives Care About. My name is McKinley Thompson. I'm the Healthcare Marketing Manager here at Dude Solutions, and I'm going to be the moderator for today's presentation. Just before we get started and I turn it over to Kevin, I want to go through a couple housekeeping announcements. First and foremost, the phone lines have been muted, but we definitely don't want that to discourage any participation. So please do submit your questions throughout the presentation as you have them. We will be addressing them in a Q&A session at the end, so please, whenever something comes to your mind, go ahead and pop that in the bottom of your screen where it says Q&A. Also, this session is being recorded, and a copy will be distributed within 24 hours. We'll get the recording and the slides over for you to share with your team and for you to refer back to in the future. So with that, I'm going to turn it over to today's presenter, Kevin Eaton. He's our Senior Solutions Advisor here, and he works with our healthcare facility management teams, advising them and presenting on a lot of thought leadership, such as this webinar here today. So we're really excited to have him share some things he's been hearing in the industry, and I'll go ahead and turn it over to him. Kevin?
Yeah, thanks, McKinley. I do appreciate it, and appreciate everybody taking the time to join us today. Hopefully we'll be making good use of your time. Do encourage you guys to ask questions. Happy to answer them as need be, and definitely want some interaction. So when you have a chance, if you have any questions whatsoever, use the button to ask them, and we'll address them at the end. An agenda for today's slide, we're going to talk a little bit of a background, why we're putting this webinar together, why it's important. We're going to talk a little bit about the executive team, the C-suite, kind of analyze their role in the organization, who they are, what they care about. We'll talk a little bit about data as well, sort of the new economy, the precious resource that is the data that you guys have at your fingertips or can have. And then talk about some other metrics or other ideas around what's important to your executive team. And then we'll jump into the questions as discussed. Based on the years that I've spent in the facilities management industry, in healthcare and across industries, there's often a perception problem around the facilities team and facilities leadership. You see sort of a facilities director thought of at times as sort of a hero who might come in and save the day, return to wherever it is they make their home and wait for the next emergency, or at least that's a perception among sometimes executive leadership or others throughout the organization, or maybe the opposite, maybe the facility director as a villain, as somebody who's breaking the bad news about a large-scale expenditure that you guys are going to have to take on in order for the success of your facilities group and organization. But that's not what the reality is that I see with my clients day to day. Something more in between, somebody who's a strategist, a creative problem solver, somebody who is passionate about the role they play in their organization and the role that they play in supporting the mission of that organization. I was at the American Society for Healthcare Engineering conference this summer listening to George Mills speak. And he was talking about his early on experience in the healthcare environment and arguing with a senior nurse about shutting down a certain corridor or section of patient rooms, and getting to through this tug of war of kind of getting 2 rooms at a time to complete his project, rather than being able to just shut that down and do everything he needed to do. And his words at the time were, this place would be great if it weren't for all the patients. And he described how that evolved a little bit as time went on, particularly when he brought his son in for a procedure, and the nurse collected his son in a little radio flyer red wagon to take him up to get checked in. And the change in his perception of the patients are why we're here. They're not sort of ancillary part of this, but that kind of passion that you see throughout the industry. And finally, I see them as a steward of resources, and I'm sure you guys see yourself this way as well. When you look at most healthcare organizations, their #1 outlay in expense is going to be paying their people. clinicians, everybody throughout the organization, but their second largest expense or investment is in the capital infrastructure that's been being maintained by these facilities teams and the facilities directors. So after that, you see the clinical equipment, the IT infrastructure, but obviously having such a large portion of the organization's investment under your wings makes you have to be a very good steward of resources in that vein. So after the perception problem, what I see is sort of a resource problem, where the clinical mission of most of the organizations that I work with says that basically we're going to have to keep our focus on the clinical side, on the patients. So how do we reduce costs? Well, let's cut in other areas. Facilities being such a big cost center, obviously they want to drive those costs down. And then you get this tug of war with your other departments, the MBAs and the C-suite, clinical staff, going up against them for different projects, right? Obviously, this is an MRI machine. Hopefully, you haven't seen the inside of one, or if you did need one, you were able to get an appointment and get that all resolved. But this is the kind of thing you're going up against, right? When you're fighting with the clinical side for dollars, you have this machine that is potentially life-saving and has a huge impact on the way that the physicians and surgeons and other treatment providers are going to approach their care. And maybe at the same time, you need a roof. So you're sitting here thinking, I need to replace this roof, but they're coming to the table with something that has got a really strong emotional impact that furthers the mission of your organization, that has all of the appeal of brand new technology, and yet again, you need to replace the roof. So there's sort of this really tough situation that you're put in, in trying to get these projects approved, especially when you're competing against the clinical side for these dollars, is, it's maybe not as sexy as, some of the better or newer technologies for patient care. So one of the things that we see on that resource problem note is that, in a survey that we put on with Health Facilities Management Magazine during a webinar we hosted, 2/3 of facilities team members had had projects denied at least once for lack of justification. So data to support those requests is absolutely necessary in order to get it approved and approved the first time, right? So, measure your data twice, cut once, get that project approved, and move on to the next thing. So that's part of the reason we're putting this all together today, is to help figure out how can we get around some of the perception problem on the facility side, utilizing data, and how do we get past some of the resource problems that your teams might have, again, with that same data, and actually being able to communicate it in a way that your executive teams or C-suite will understand and support. So one of the things in my interactions with CEOs and CFOs at different health systems and organizations across the U.S., I found is that it is often lonely at the top, right? The higher up you are on that food chain, the fewer people you have to bounce ideas off of, the more responsibility you carry. Your decisions have a bigger impact on the organization. And one of the things I see my clients do have a really good relationship with their executive team is they're curious. They want to know information more than just what are my responsibilities, but what is the organization working on as a whole? Understanding what percentage of the budget pie is their responsibility, understanding what initiatives or goals around revenue the CFO might have, what projects are on the radar of the CEO so they can provide feedback or look at how they might fit their department into the project. Obviously, you know, everything we go over today, there is no particular silver bullet regarding kind of how you approach communication with your leadership, but it's definitely something that you might want to consider as you look at, you know, working with the team or getting to know them, spending more time, you know, having your one-on-one meetings with them. Is just understanding, you know, who are they as a person? How do they like to receive information? What's going to be the most effective means of communication to ensure that they're getting information the best way they receive it, so you're on the same page. So this is something where, you know, doing that kind of research around, well, what's the best way to approach somebody who's a driver or more analytical. There's a lot of different studies out there, but this will help ensure you're speaking the same language and they're hearing everything that you have to say. So data is sort of the new economy now, right? Most precious resource for almost any organization as they go to make decisions, as they you know, collect information, whether it's through electronic medical records, billing systems, marketing information. There's so many sources of data out there. There's such a data-rich economy. Now it's becoming more about having the foresight to understand what is the most important data to the success of your organization. I think back to Southwest Airlines, for example, in the 80s, not being profitable, having to figure out the way to continue to profit and success. And one of their leadership team members determined that the best way that they were going to be able to meet their goals and maintain profit margins is to have a KPI of turning around a 747 in under 10 minutes, and committed to that idea. And that was the year that decision was made, was the first year that they were profitable, and they've been profitable every year since. So it's not just about figuring out what data there is to track, but what is the most important data to ensure the success of your organization. So we're going to take a look at a few different sets of key performance indicators, industry standards, and some of our own recommendations that you guys can use. So this information here is actually maintenance productivity data collected in a CMMS, and it's developed, these KPIs were developed by ASHE and IFMA in their benchmarking 2.0 study. They went through and figured out on the people they surveyed who was collecting this productivity data. So this isn't the, you know, average response time, it's just a percentage of people who are actually tracking this data in their CMMS platform. And based on my experience and what was also in that report, that 83% of hospital organizations have a CMMS platform, I look at these numbers and think to myself, they are way too low. If 83% of healthcare organizations have a CMMS, there's no reason that only 26% or a quarter should be tracking the number of service complaints. There's no reason that 12% should be tracking the percentage of budget spent on breakdown maintenance. This is all information that should be at your fingertips. So these are some industry standards that have been developed as a KPI according to ASHE and IFMA, but there are other ones as far as cost standards as well. So obviously you can't manage what you can't measure. Knowing where you fall in this range of maintenance costs per square foot is going to be something that's helpful as a means to charting a path for improvement, setting the goals for your department. The same goes for the utility spend side. What are the initiatives that can get you from that sort of $3.23 average to something closer to $1.26? You know, not everybody's going to have the luxury of being able to take on those projects or get down that low on energy spend. But if you don't know where you're at, how can you set your goals? How can you chart your path from here? So From there, our KPIs, the things that we recommend to our clients that they should be tracking. This is around staff management. How are you responding to emergencies? How are you responding to different priorities of work orders? How are you evaluating that information? So again, you can make those adjustments or chart a path towards better success. If you're able to see that certain employees have a much higher work order count, you can start to identify the outliers so you can expand that information and say, how do we get one of our staff members to coach up the rest so that they're as productive, so that they're as efficient. Cost category comparisons. What data are you collecting on the spend that you have? How do you know what your largest piece of the pie is as far as spend on things like HVAC, life safety equipment, anything structural or other areas, so that you can figure out where you have the greatest room to improve, where you have the ability to make changes. If you're like most facility managers these days in the hospital environment, you're no longer just managing everything under the roof of the hospital that you are a part of. You have outlying clinics, medical office buildings, behavioral health, or sometimes attached independent or skilled nursing. So, finding out building by building, site by site, how they compare, and gives you, again, that opportunity to identify those outliers and replicate success or address any failures you might have. And then a pretty typical example of key performance indicators is checking on percentage of purchase cost at an asset level to make those repair versus replace decisions, where you can say, I want to keep most of my assets under this sort of 30% threshold. And if they're not a high risk or not part of your utility system, say, I can run to fail after this side and save myself the resources and man hours on PM for a particular piece of equipment. And lastly, the clinical and safety environment. What are the trends in the environment of care? Where are areas that we can improve patient safety and quality? And what are the initiatives that we need to engage in order to do so? The better information you have on trends and data around environment of care compliance, around EOC rounds, deficiency responses, the better you can, with your EOC committee and safety team, create strategies to be able to make changes. Now, all of this data together does give you a really good data set to start making the case for different items, but you have to know this information. And now is probably a good time to stop and just think, do you have these numbers for your organization? Do you know what the cost per square foot is? When it comes to your equipment inventory, do you know how up to date your asset inventory is, the age of each piece of equipment, what condition they're in? These are the things that are going to help you strategize beyond the day-to-day operational level and start thinking about replacements or what you can do to make your department more efficient. So if you don't know that information, obviously you can't measure it or you can't manage it. So what we've seen most organizations be very successful with is having a dedicated product or service to measure all of these items. So having something for work requests, plan maintenance and asset management. And because we're in that healthcare world, making sure that it's specific to the compliance needs that you have, that they're able to do things like risk assessments at an asset level, track and measure an AEM program, ensure that anything infection control is separated out and has that 100% PM completion percentage. Having the functionality around built-in elements of performance, EC code, life safety codes, NFPA information, all of that together is going to give you the data you need to measure your own department's success and ensure that when Joint Commission walks in the door, you have everything you need because obviously they may not be your C-suite, but you'll certainly hear from your C-suite if the Joint Commission has a number of findings. So when we look at all of these things together, there has to be a place for you guys to be able to measure all of this data and capture it. Another few tidbits from that benchmarking 2.0 report, kind of around what was being captured. These numbers are just way too low. So one of the reasons that we find that that's the case is you're not just relying on yourself to capture all of this information. It requires a cooperation of the facilities team, all of your technicians, the requesters who put in work orders. And one of the bigger challenges, and the reason that the numbers are so low across the board, is folks are still operating primarily on paper. People are utilizing systems that are too complex for the needs that they have in the field. Anything that should be happening should be recorded instantly when it happens. Otherwise, the further you get from that instance of a repair, the further you get from that instance of a PM completion, the less likely that the data that's entered is going to be accurate or that it's going to get entered at all. A lot of the clients that I work with have teams that are still primarily being handed work orders, going out in the field, writing down their notes. They get back at the end of the day, and rather than sit at a computer and type in what they've done, they'll stuff the records in a drawer or just hit complete and move on. And if you empower them with mobile technology to enter in the information at that moment of completion, at that moment while they're in the field, it's more likely that they're going to get everything in that's necessary and that they're going to be able to then move on efficiently to their next job and continue that process. So capturing the data is of critical importance. And if you're not using a mobile friendly product or an easy to use product for your technicians and requesters, you're not going to get good data back in. So obviously we want to measure all this information. We want to collect these key performance indicators, but we want to empower our staff to do so in the way that's going to be easiest for them. So that's sort of the strategy around getting the data in. We've given you what the industry standards are as far as KPIs and cost. We've given you our recommendation on things that are key to track within your team or ones that you might consider as key for your teams. Now it's how do we use that data, right? So when I think of project justification, I think of it as creative communication, right? It's not just, the problem isn't that the projects that you feel will be most impactful aren't important. It's the difficulty of supporting it with data that speaks to the folks who hold the purse strings. So when I think of something that I see my clients using in order to get those approvals, I look at risk analysis. What are the areas of risk that might be something that a C-suite executive might be averse to, right? So revenue loss. I had one client who had a chiller that was having issues and that fed a patient tower that supported a certain number of beds. He did the math on average per bed revenue for the hospital, did the math on what a failure would take to repair as far as if it was total loss and they needed to, spend a certain amount of time for the project and shut down those beds, and calculated out over the course of that time the cost per day per patient bed, and had a total number of almost $750,000 over the course of the time that those patient rooms would be shut down. He used that as his justification. Or if you look at things like potential litigations, fines, anything that CMS might cite, or bad press, that has even bigger impact on the reputational value. So, losing not just whatever fine happened or anything that was shut down, but also the future impact based on the hit to the reputation. The next area I look at is cost reduction. So Things like being able to justify bringing in a specialist or changing your vendor based on the data that you have on cost and performance of that vendor. Wherever you can find efficiency gains, productivity gains, things that are going to help your team perform better, you can use that information to show your administration sort of a return on investment, taking those things together and creating a timeline for the return on that so that they know, okay, yeah, it's going to be a hit this year, but it pays for itself over the course of the next 4. However you calculate that, it's a big consideration. So you've got all of the data together, you have sort of the categories around it, but sort of tell the story, give context to the information that you have. So, let them know the day-to-day activities of your department, where they're at, how responsive they are, the percentage of your work that's in-house versus outside vendors. Look at things that can help them understand your responsibilities day-to-day and what you operate with. So then there's some other things that you can kind of bring to the table, looking at cost per piece of equipment categories, inventory and total portfolio, so that they can, be on the same side of the table with you, where maybe, yeah, I can't afford to replace this boiler in, the first 2 quarters. If you can make it last that long, and save us that budget money, then we can approach this project in Q3 because we lost a physician last year, so we had a reduced revenue for a long period, or whatever the case may be. Start to be part of that conversation where you're on the same side of the table and not playing that tug of war for resources. What else can you bring to the table? Obviously, safety and compliance data is going to be critical, but it just shows your commitment to the impact to the patients, your commitment to the environment, and the overall mission of the hospital. Another area where a lot of my clients have seen success is utilizing patient satisfaction data and sending out surveys at responses to any breakdown maintenance. So yeah, continue to tell that story, right? So if you have year-over-year reductions, what was the policy that impacted the reductions in efficiencies? Trends and utility events, whether it was staff skills development, training and compliance, or adoption of new technology to make your staff as efficient as possible. So tell the story, tell the narrative, and keep it going. After you get the project approved, tell your leadership where you're at on that return on investment. Now, after telling you all of the value of data and communicating with your executive team, I will take a step back too and say that maybe data isn't the only thing that you can use. I think it's important too to define your department's mission and vision and how it fits into the organization as a whole. Think of things like, what is our philosophy on an approach to service? If I'm going into a patient room, what are the questions that I ask? What are the statements that I make? How is it that I'm interacting with this patient, and how is it that I'm fulfilling our mission as an organization? Obviously, providing an emotional impact is something that I think in the context of healthcare organizations is actually a really great thing to do in business, because you guys are in a position where the mission of your organization supports some pretty dramatic recoveries and pretty dramatic results for individuals and families in the community. Thinking back to the radio flyer story with George Mills, the reason that the story is so great that he kind of came around and realized once his own son was being checked into that hospital, why he was actually there is because there are so many stories like that in the healthcare space. So, whenever you have the opportunity to talk about your impact on an individual patient or a patient's family. Those are the stories that need to be told, and they're really important. So, yeah, I think those are some of the trends, the way that we had kind of talked to everybody in our client base, some of the things that we have been looking at. Obviously, we're a software provider here, and not just on the side of communicating with your leadership. And we have some solutions to help you guys solve some of those problems, help collect and capture that data, ensure that your staff is being as efficient as possible with mobile technology, and really kind of lead to some of the successes that we talked about today. So obviously get in touch with us if there are any questions that you have. We're going to take a look at the question and answer session in here in just a moment, but I think we have a poll for you guys as well.
Yeah. Thank you so much, Kevin, for that. As we said, if you would like any more information, we've popped a poll up there on your screen. There's also the ability to chat us a question with the Q&A session, the chat button. You can raise your hand if you have a question, but please go ahead and answer this if you'd like any more information. If you're a current client but would love to know how to pull some of these reports that Kevin's talking about today, we'd certainly love to help you with that. So with that, we're going to have another minute for people to chat in their questions, and then we'll go ahead and get started with Q&A. Someone has their hand raised. We're going to go ahead and get to that.
If you have your hand raised, Eric, it looks like you had a question. If you want to go ahead and chat that question in, we'd be happy to answer it. All right. Other than that, we are going to go ahead and wrap up the polling here. And there were no questions that came in on today's session. Nope, there it is. So does the system have the capability to graph or export to Excel was the question that we got. And yes, absolutely. You can go to Excel, do charts within the product itself, or if you're better with pivot tables and want to utilize that, you can definitely do that as well. So there's that kind of capability to take that information and chart it against, whether it's site by site or whatever the case is. And then we had another question about the Joint Commission standards and CMS standards that we have. How are they updated? So we utilize and vet that information through partner consultants that we work with to ensure that it's up to date. When there are changes in standards, such as last year's NFPA 2012 Life Safety Code adoption, those standards are also updated. So thank you. Right, and I'm not seeing any other questions at the moment. So thank you all for taking the time to join us today. If you have any questions outside of what you saw today or would like any additional information, again, feel free to reach out to us. We'll be sending out this presentation here within 24 hours, and we'll look forward to having you on another webinar in the future. Thanks again, everyone. Have a great day.